Good morning. All right, welcome to the session. I'm David Spira, Managing Director at Deloitte, where I work on water, energy, and climate challenges, primarily focused on international development. But it's a particular pleasure to be here today to talk about some of the challenges in the high-income countries. I'm delighted to open the session on the last day of the UNC Water and Health Conference. It's been an enriching week at the conference, learning about how various key topics in the global water sector. Today, we'll delve into the unfinished business of water, sanitation, and hygiene in high-income countries, with a particular focus on the finance and governance challenges faced by water utilities. I would like to extend a special thank you to our other session partners, UNC Environmental Finance Center, and Dr. Ahmed El-Khattabi, thank you, hope I'm getting that right, who will lead the second part of the session. As well, the North Carolina Department of Environmental Quality and the U.S. Environmental Protection Agency for their efforts in putting together this session. Brief session overview. Water utilities are tasked with ensuring clean drinking water, adequate sanitation, consistent, reliable service, long-term sustainability, and adequate investments in infrastructure. They must achieve all this while striving to charge affordable rates and conserve limited water resources. In some high-income countries, such as the United States, water utilities are expected to operate as financially viable units. This expectation presents significant challenges, particularly for utilities serving small customer bases, leading to a growing gap between infrastructure needs and available funding. This session will explore these challenges and discuss sustainable financial and governance solutions to maintain the viability of water utilities. Before I go on, just a moment about Deloitte's work in the domestic water sector. We play an important role in improving water utility performance, including support for supporting access to energy, access to finance, to ensure communities have access to reliable and sustainable water services. For example, we serve as advisors to the EPA's Water Infrastructure Finance and Innovation Act, the WIFIA credit program, which seeks to accelerate investment in the nation's water and wastewater infrastructure by providing credit assistance for investment in aging infrastructure resiliency, and delivery of affordable drinking water and wastewater services. It addresses some of the issues we heard during this morning's plenary with the head of the EPA. Deloitte works with EPA to review creditworthiness, stress sensitivities, and provide an assessment of affordability of water and wastewater services. Over the course of this week, we've already heard a lot of interesting discussions about the challenges we have here in the United States and other high-income countries. I'm excited to delve into this research and insights our presenters will share with us this morning. Very briefly, well, let's get to the presenters. We're really pleased to have a group of experts with us today who will talk more in depth on their research on this topic. I think unfortunately, Carrie Ripley couldn't be here this morning, but we'll have Alicia Thompson, the program officer for the CDC Foundation. We have Grace Ferry here with us this morning, researcher and PhD student at Wash at Leeds University. Kate Sawyer, assistant field manager at the Rural Community Assistance Corporation, and Elizabeth Vicario, research assistant and PhD candidate in environmental engineering at the University of South Florida. They will each present their research and findings for 10 minutes, and we will allocate 2 minutes after each presentation for a brief Q&A. During the second part of the session, Dr. El-Khattabi, the interim executive director and associate director for research and data at the UNC Environmental Finance Center, will facilitate a discussion with an esteemed panel to further explore these critical issues. With that, our first presenter, Alicia Thompson, just a bit of background on her presentation, on her research. An estimated 2 million Americans lack access to basic water, sanitation, and hygiene services. These gaps often align with racial and socioeconomic lines, reflecting historical and ongoing marginalization. Alicia will delve into how innovative partnership models have been leveraged to address WASP challenges within marginalized communities in the United States. Thanks, Alicia.
All right, well, thanks for inviting us to talk today about the project that we recently completed at CDC Foundation. And I will say Administrator Regan seems to have read my notes and has set me up pretty well. So I'm going to talk about a funding opportunity that we released about 1.5 years ago and the model that we used, and a little bit about the evaluation of how effective this model was for the WASH sector here in the United States. Very briefly, for a little bit of context to the CDC Foundation, we are a private nonprofit commissioned by Congress in the 90s to further the impact of CDC. So we are separate. Just wanted to clarify that difference. But as was introduced, we do know there are at least 2 million people in the United States that lack access to WASH here in this country. And these are falling along pockets that are lining with historical patterns of marginalization. And so when CDC Foundation received a private donation to do social investment work, we knew we wanted to dive into the domestic WASH space. And we wanted to follow a model that we've used previously that we found a lot of value in. So we ended up supporting 6 community-based organizations in 7 locations across the United States to address WASH issues and find solutions when applicable that are very specific to their community. You can see the program outcomes that are on the screen. All of the projects that these community organizations developed were formulated to address these outcomes here. And then we also at the foundation, anytime we're working with these CBO models, are doing what we can to help expand their capacity to work with federal and non-federal funding in the future. So why CBOs? I think, Administrator Regan touched on it a little bit earlier today, and then yesterday was also mentioned. Communities are the experts of their own lives. And as Monica Lewis-Patrick, the water warrior with We the People for Detroit has mentioned, organizations, funders, philanthropists really should lean into community brilliance, as those closest to the problem know best how to address it. So at the foundation, we use this model across a variety of public health fields with COVID-19, HIV self-testing, and now domestic water. And as you can see, kind of following Lowndes County, which was mentioned, we did work with these 7 locations. And you can kind of see some of those pockets that it's falling across. The Navajo Nation that's experienced a lack of water for a long time. Adelanto, California, which is next to a Superfund site. Black Belt, and then the Appalachian region. So we did this work. We wanted to evaluate it to make sure that, even while we were doing this for just 1 year, we could show the effectiveness for future work, because we did know at the foundation we would love to dive into this more. And kind of going hand in hand with the CBO model is something that was also mentioned Wednesday during the finance plenary, trust-based philanthropy, which is something that we embrace pretty frequently at the foundation, is ensuring that we are doing what we can at the foundation to support our values, but also support our fundees in working towards their program identified goals. So our monitoring and evaluation strategy for this project, which Carrie led, was really meant to ensure that we were finding insights that were useful to CBOs. So our fundees contributing to that broader evidence base about whether or not this model works when addressing WASH gaps, and then also measuring their perceptions on the support we provided. So this is just very briefly for anybody who's a monitoring and evaluation nerd. We used mixed methods approaches. We had quarterly reporting the fundees gave back to us, which is very common for a funder-fundee relationship. And then we wanted to ensure that the community served by these organizations felt that this support was helpful. And then third, we surveyed the staff within the partner CBOs to understand how they perceived our support at the foundation. I'll touch briefly on the output indicators because this kind of fed into our overall evaluation, so you can see how powerful it can be to work with these organizations in the WASH sector. And these output indicators are grouped into kind of these three main buckets of technical implementation, which is the things like installing plumbing, providing water filters. Number two is advocacy and raising awareness of WASH issues here in the United States. And then three, outreach and education. So I'm not going to go through all of these numbers, but I think it kind of gives you a general picture of how effective this was. And this was spring 2023 to spring 2024, so 1 year, which, as we all know, WASH is a very long-term issue. So the fact that we have this impact information from just 1 year is pretty powerful. They reached nearly 50,000 people through education and outreach. And then pretty significantly, we really did not expect as much of this advocacy effort accomplishments as we saw. But CBOs reported that because they partnered with CDC Foundation, they had a sensibility lent to their work and were able to catch the attention of EPA, DOJ, and a lot of these other government stakeholders. So briefly, kind of going back to those program outcomes, outcome one was increasing awareness of WASH challenges and related issues, which I think really is the foundation of the work that needs to happen here in the United States. We found that those surveyed among the community members reported that they saw the CBO who was working with us and them as trusted. And so 91.8% saw that they very much or completely trusted the information and that they trusted the CBO to advocate on their behalf. Outcome two was increasing access to safe water and wastewater services. So they did, a lot of people did walk away from this understanding how WASH impacts their health at the very beginning. A lot of them didn't realize that connection. And then other indicators for this outcome, we used a lot of the output measures just because this was a little bit more difficult to capture. And then expanding the capacity of CBOs to address WASH challenges. We did see positive increases where people walked away from this support feeling that they could continue this work. And then strengthening relationships between different sectors. There were a lot of partnerships gained. One of our CBOs in Jackson has now established an AmeriCorps type program to continue the work. As Administrator Regan pointed out, this is a very common problem for Jackson. So we are very happy to see that this has proven sustainable. I will acknowledge, as a research mind, there were challenges. A lot of CBOs reported language barriers, but they also did report that, like in California, they walked away showing their presence at town hall meetings in such a way that the town halls started putting interpreters into their meetings regularly so that people who spoke Spanish were able to walk away informed. So to conclude, we saw even with 1 year that partnering with community-based organizations did contribute to progress in closing WASH gaps. Of course, we were looking very short-term. They were particularly helpful when addressing immediate informational and educational needs. And then for funders who might be looking to work in this kind of model, this flexible approach that we provided was able to help support greater impact. So I do want to acknowledge the partners that we worked with. We were so grateful for them to kind of work alongside of us. And then there's so much more information I didn't even touch on, but we have a poster later this afternoon if you want to swing by and talk more about this, or you can contact me and I can give you these slides.
Thanks so much, Alicia. Really, really outstanding, excellent work. I think we have time for upwards of, up to 2 questions. Please. Alicia, I'll ask one. Please.
Oh, hi, hi, thank you. I'm Sue Lyon, I work for the Appalachian Regional Commission, and I'm curious what in the Tennessee and the West Virginia sites, what actual implementation?
Yeah.
What fiscal, stuff.
I'm glad you asked. Tennessee was an organization around Nashville that established hygiene pantries, working off of this idea of food pantries where people could come in, no questions asked, and get supplies that were that they needed. And in the Appalachian region, that was kind of more of our technical implementation. So where Dig Deep is an amazing organization if you haven't met them yet. They employed local leaders to connect households to city water systems, which is typically a very high cost. So they were able to support 11 households in getting connected to running water.
Thank you.
Hi, thank you so much. Really great presentation, Alicia. A few questions. I'll try to keep it short and sweet, but as I work in TA here in the US, and I feel that the acronym WASH domestically in the United States is inherently problematic because it alienates underserved communities in the US from their middle or higher income counterparts that are water wastewater projects.
Yeah.
So just wondering if you agree or maybe disagree with that narrative. And then secondly, that like capacity with underserved communities can be very challenging. Wondering if you could touch on what capacity building efforts were part of this.
Yeah, great questions. WASH, with the foundation, we see it as water, sanitation, hygiene. And then we found actually in this project, we asked the question of organizations, partners, what does WASH mean? We got a variety of definitions. So I do agree that it's very specific to the US, but I think a lot more awareness needs to come into that. And then capacity building, I will use the example of BBUWP in Lowndes County, Alabama. They came to us with a very grassroots proposal, and through some creative thinking on the foundation's part, we partnered them with an environmental engineering agency who was able to help them lay, I would say, an operational foundation enough to the point where they actually partner with Lixil on quite a few things. And then have recently received a $14 million grant with Texas A&M University to scale up their program. So a lot of familiarity with funding mechanisms was part of the capacity. We also sponsored 12 people to attend an op-ed workshop where they could learn with journalists about how to advocate for themselves, but advocate for the WASH issues that they were experiencing through writing of op-eds.
Thank you, Alicia. Really helpful. Our next presenter is Grace Deary. Is Grace here? No. Can we go to Kate? Is Kate here?
Yes.
This is Kate.
Perfect. Yes, let's
Do we have to adjust the? Kate's work. Kate, I'm going to give you a brief introduction. All right. Kate Sawyer, everyone. Kate's work focuses on the critical issue of supporting rural communities in the United States while ensuring compliance with the Safe Drinking Water Act. Her research addresses the traditional challenges faced by rural utilities, which often rely on limited capacity state agencies and technical assistance providers. These services typically offer isolated solutions, leading to ongoing assistance needs in some communities falling through the cracks. Thanks, Kate.
Thank you for the introduction. And I should use the microphone. Okay, thanks for the introduction. Hi, everyone. Yeah, that might be better. Appreciate it. Okay. Great. Well, so we'll dive into, this is kind of a case study diving into New Mexico, because the state of New Mexico has been doing some really interesting things really over a 20-year period, multiple decades, to the extent where they have a pretty robust toolkit compared to many other states in the country that are available to support rural water and wastewater utilities in terms of fund incentives and funding to partner together and work together in different ways, and has done a lot of policy and intentional policy and legislative changes in New Mexico. So we'll dive in and talk a little bit about the context for how that's come about and some of the specific changes that they've done. So I'm here representing RCAC. RCAC is the Western branch of the RCAP National Network of Technical Assistance Providers. RCAP has several hundred field-based staff really based in every corner of rural United States of America that collectively are partnering with thousands of communities every year. So to give you an example of the type of this is northern New Mexico, Moore County in northern New Mexico, to just give you an example of kind of the context of type of community water systems that we're talking about here. Moore County has 15 community water systems that serve the population, ranging from a couple dozen connections up to just under 400 connections. So very small systems, very aging infrastructure, a lot of infrastructure issues. Most of it has not been upgraded and very much needs to be upgraded. The management model that's kind of classic for most of the hundreds of small community water systems in New Mexico is mutual domestic water consumer associations is the most common. That's really a community-based management model, meaning that it is volunteer run from volunteer boards of community members overseeing their drinking water services. Most of this population is very much aging. There's very kind of cultural issues with succession planning and an ability to recruit younger folks in to run these aging water systems. And so the compliant, you can see this overall lack of technical managerial TMF capacity that is just running rampant in most of the community water systems in New Mexico and in rural America. And you see the lack of capacity come through in very low compliance rates. When we did this study and this report in 2023, we looked at the compliance of all 15 water systems in Moore County, and they were only at an average of 50 for all the compliance regulations that we could review via public record and easily find information on. It was an average rate of 50% compliance, and this is despite, which is pretty low, so despite really significant investments from a lot of different types of assistants and assistant providers to achieve better compliance than that. So a lot of challenges for these communities. And so now I'm not going to spend a ton of time on this slide, but I do want to introduce and define regional collaboration as really a path forward that Moore County and many other counties and water systems around the state of New Mexico have become interested in. Sometimes you might hear regional collaboration have other terms. If you've been around this sector for a while, regionalization, consolidation, partnerships, most recently restructuring with the EPA's newest proposed rule for the water system restructuring assessment rule, which is very big news. And so this is going to become a very bigger deal in the United States with the EPA getting involved in the supporting regional collaboration and trying to push this agenda. And I just want to clarify, if you have worked on any type of regionalization or regional collaboration projects before, sometimes there's a bit of a misconception that it's all about mergers and acquisitions and consolidations. That is absolutely not the case. It's absolutely not the case. There's an entire menu of things that ways that communities can partner together and build their resilience and collaborate together to be able to provide more sustainable and more professional water services that are not an ownership transfer. That can be a little bit touchy and political in certain areas, all the way from informal agreements, contractual agreements, to shared governance models. And I think we need to consider all options and present all options to communities that want to improve their services. And the point of this slide, just to point out that this is really a systemic issue, and sometimes we get stuck helping communities on a one-by-one basis, and they have a lot of challenges at the operational and with their capacity, but there's such an overwhelming number of public water systems in this country that struggle with these capacity issues that it can be hard to really make true and long-term progress. And so I wanted to highlight that we have been shifting in New Mexico our work, rather than kind of working one by one at the utility level, working to try to solve challenges more at the regional and at the state level. And we've seen a lot of success in that by kind of changing the way the level at which we're working. And we found that partnering with regional partners and state partners has been has created some long-term change. So the rest of my presentation is really this one slide and a whole 20-year timeline of legislative and policy changes that the state of New Mexico has done to support, have a much more robust and innovative toolkit from which to support communities who are wanting to build their capacity in robust ways and wanting to collaborate together. I have a pitch. I have a bunch of printouts of a report. There's an executive summary too. You don't want to read the whole thing, where there's a lot more details about every item on this slide. I probably only have time to mention maybe 2, 3, 4 of them. But really, I'll just start in 2005. There was a really interesting gubernatorial action and legislative action, the House Joint Memorial 86, that recognized, New Mexicans recognized, hey, there is a water crisis in our state. Our rural communities, our small communities are being left behind. We do not have, in a robust way that a lot of states have not really recognized, that there's kind of this last mile and exclusion issue. And they said, we're going to bring together a bunch of folks and what is our water crisis? And let's define it. And why is that happening? And the state recognized that there is an inherent structural lack of capacity within their rural communities in 2005. And a lot of actors kind of got on board and started speaking the same language. So there started to be a lot of like kind of coalition building and momentum of folks, important folks that were speaking the same language, which is really important. I'll also highlight in kind of the late 2000s and into the 2010s, a lot of regional water authorities started popping up and being created. It was really, there was a lot of policy and funding. It can be very expensive to create a regional authority, a very political, very burdensome legislative process. So there's a lot of barriers that prohibited that from happening. So we only saw it a couple times really led by the highest capacity water authority. You know, if there's maybe a city that was interested in supporting some of the rural communities around, the city would have enough resources to be able to make that water authority happen. So we started seeing it led more so by the higher capacity utilities. I'll point out in 2010, the Lower Rio Grande Public Water Works Authority is a fabulous case study. There's case studies written about them. You can go to their website and look up their mission and how they've grown over the last 15 years since they were founded, of now supporting a couple dozen very small communities and basically the kind of the lowest capacity communities in an area of southern New Mexico. And they're a really cool regional water authority that does some incredible things. I'll point out in 2022, there's another gubernatorial executive action that created a water task force that brought together a bunch of different, it was a cool process. It brought together a bunch of different stakeholders from around the state, public and private, all the water stakeholders that knew anything about water and the water crisis. And they said, we want to invest resources in this. We want to figure out solutions. Give it, 12 months, get together, do this task force and give us recommendations. How can we make a difference for New Mexicans? One of the 5, they developed 5 key recommendations from that task force in 2022. One of them was regional collaboration, support regional collaboration. Communities are asking for this, and we need to provide pathways for communities to work with their neighbors down the street and be able to offer more professional and more sustainable services. And there's just too many barriers to allow communities to make that happen in a meaningful way at scale. So there's been a lot of really recent political momentum coming out of that 2022 effort. You can see a bunch of bullet points in the last 2 years, and there's more legislative things up on the docket in 2025 next year. New Mexico Environment Department, the primacy agency, did an internal restructuring, and they created an entire unit that had been dedicated to helping utilities in a one-by-one, kind of small utilities that were struggling with compliance in a one-by-one basis. And they renamed themselves and restructured themselves and called them the Regional Resiliency Team, because they said, if we want to build resilience within these rural communities, we need to work at a regional level. This 2023 legislation that was passed was really a landmark thing and a big win personally for my organization that we've been working towards for many years. There was not a legal framework that allowed water systems who wanted to have shared governance structures to work together. So anytime that 2 systems wanted to work together, it needed special legislation. And it was a very burdensome and very expensive legal process. And so this legislation was created and finally got passed that now has a legal framework for any 2 types of water systems, no matter what type of legal entity that they are, that they can now work together and merge or have a shared governance structure or do what do what they may want to do. There's been a lot of funding and policy changes to better incentivize collaboration from all the different funders in the state. And so that I am now done at my 10 minutes. Thanks, I talked so fast. And if you'd like to learn more, here's a QR code to this report, or I would love to please not take all of these home with me. It's really, there's a lot of goodness in that report. So get in touch if you'd like to chat more.
Hey, Rich, maybe I'll send you questions from the audience. We're gonna take this mic. You can have this. Okay, I'm gonna ask a question to Kate, if that's all right.
Sure.
Kate, can you, on that legislative timeline, can you just maybe two quick questions? Any, has the support been largely bipartisan in the state of New Mexico? And maybe secondly, is there any data being collected about the increased sustainability of these rural communities and
That's great.
that are being able to not move to the major cities, but
Sure.
from population staying there to their economic productivity, anything like that?
Yeah, sure. Great questions. Yes, it's been largely bipartisan. Although not, there is also a bullet point that I left out that to do the particular legislation in 2023, we had a first attempt in 2016 and it failed and we learned, and we did a second attempt in 2019 and the third attempt in 2023 got passed because there's a lot of, we've learned a lot about passing legislation and advocacy. It's a really tough thing to do, but it has been bipartisan. Yes. Sorry, your second question was, the sustainability. Yeah, absolutely. And I'll be totally honest. I'm used to be a monitoring and impact evaluation person myself. There is, in the domestic wash sector, my impression is that there's really little resources to dedicate to actually monitoring those outcomes. To actually say, yes, these are sustainable now, and so we tried to do with this report, we tried to look at secondary and data and to look at compliance rates, easily accessible things to show compliance. But I do, my personal opinion as a monitoring evaluation expert is that there's a gap in resources being dedicated to studying this. There's a lot of case studies that are anecdotally talking about the resiliency that regional entities have. There's a lot of folks, I'm definitely not the only one talking about this in this sector. It's a lot of folks are talking about it. And I do think that there's some folks that are trying to look into recognizing the need to maybe do some significant in-depth evaluations of case studies, such as the Lower Rio Grande Water Works Authority. They would be a fantastic candidate to have an in-depth study of their sustainability and impact. Yeah. Okay.
Okay, thank you
Yeah.
very much. I think I took up the time for questioning. Apologies. Our next presenter, Elizabeth Vicario. Okay, wonderful, Elizabeth. Elizabeth is a research assistant and PhD candidate in environmental engineering at the University of South Florida. Elizabeth's research focuses on the resilience of urban water suppliers, which she defines as the ability to provide equitable, affordable, and reliable service despite various shocks and stresses. Her work addresses critical issues such as water scarcity, poor water quality, and aging infrastructure, which are expected to worsen with changing global demand and climate patterns. This right?
Yeah.
Thanks, Elizabeth.
Thank you for those awesome presentations. This is quite different from those. Yeah, so I'm at the University of South Florida. I'm a PhD candidate in environmental engineering. So again, this will be different. But I'm presenting today on my dissertation research. Unfortunately, I don't have time to talk about the work in Accra, and today's focus will be on my work in Tampa. But if there's questions about my work in Accra, then come talk to me later and we'll talk about it. So some takeaways for today, I'm going to be talking about participatory systems thinking, which is kind of like a broader framework or a set of tools, and also talking about how it's really accessible for different kinds of organizations. It can be used to uncover hidden feedback loops, vulnerabilities, and pathways to resilience. Some background about this study. I am not going to go too into this because we have had so many great plenary sessions about all these different threats to utilities and public water systems in general. Like we heard from Administrator Regan today, and then also a broad discussion on financing if you attended the plenary on Wednesday. We don't have enough water in some areas in the United States and all over the world. And even in Florida, you might think that Florida, it rains all the time. Actually, it doesn't. 9 months out of the year, it doesn't rain that much. Water can be poor quality, and that can be compounded by climate change, population growth, industrialization, other threats. And these socioeconomic threats down here, I think I can. Yes, great. These public distrust, inability to raise rates, and rising project costs and difficulty financing, which again, we've discussed. Interesting that we just talked about regionalization, which I have as a threat, and you talked about as an opportunity. And then, of course, human resources, cybersecurity threats, and other things. So these 4 pillars are kind of the broader framework that I'm using to understand resilience. It's not just about strong infrastructure. So a lot of people in my field tend to understand resilience as, you know, the 3 R's, or they have other little catchphrases for resilience as trying to withstand hurricanes, withstand whatever strong storms come their way. But it's about so much more than that. It's about organizational resilience, especially. That's kind of where I'm kind of seeing a lot of the focus draw me to, especially in the short and midterm with human resources challenges, risk assessment, regulatory compliance, and just making sure that the utilities are able to last until the end of the week, until the end of the year, and just, you know, keep their house in order, basically. Social and economic resilience are also very important, of course, but I'm just not seeing the case studies go in that direction, because as a system thinker, I have to kind of meet them halfway and see where the problems are. So some background, these are my 3 case studies for this research. You see the third one is quite different. That was made possible through a Fulbright scholarship and a partnership with the University of Ghana. So yeah, don't have too much time to talk about that one, unfortunately. But all 3 of them have different problem statements. So that's because, of course, each of them is operating in a totally different context. So the 2 in Florida chose to meet me halfway with our problem articulation, and they wanted to talk about water reuse problems that they're having. So that's what's going on in Florida in my 2 utility case studies there. And then in the city of Accra, I worked with a small informal settlement on water theft that was happening there. So I'll talk about my framework a little bit, starting at the very beginning. What's a system? A system is a set of components interacting that form something more meaningful than each of the components does on their own. So systems thinkers like to focus on complex systems, which is not the same as a complicated system, because a car is complicated, but it's actually not a complex system because of the outcome is predictable. You know what a car does. If you step on the gas, it goes. Complex systems usually involve human behavior or decision-making or something that's slightly unpredictable. Systems thinking is appropriate to investigate complex problems because it uncovers hidden feedback loops and matches them to system behavior. It's transdisciplinary, or it can be. It can be participatory. It's very easy to involve a group with systems thinking methods. And some methods can also simulate possible futures, which can solve problems, or it can simulate extreme events like a hurricane. So the specific method that I chose to use, or the tool in the systems thinking toolbox, is system dynamics modeling. And that's because I'm working in a very data-rich environment in Tampa Bay. So system dynamics modeling uses both information flows on the left over here, which you might have seen before as a causal loop diagram, or just a simple, you know, the chasing arrows or something. More economic activity leads to more population, and population leads to more economic activity. Very simple. And then on the right, if you're an engineer, this might look kind of familiar. Material flows through a system. That can be money, people, air, water, whatever. So here's an overall chart of my methodology. I started at the very beginning, trying to meet people with a problem statement. So what's a complex problem that we can come up with that will be appropriate for you and helpful for you to model, that's also a complex problem and appropriate to model with system dynamics modeling? So we tried to focus on, they wanted to focus on an imbalance of supply and demand for reclaimed water, which is quite common in cities with reclaimed water in Florida because of the seasonal fluctuation of rainfall. So reclaimed water comes from wastewater. So there's a pretty constant supply if you have a constant supply of wastewater or constant population throughout the year. But because of the rainy season in the summertime, people are not using reclaimed water to water their lawns, which is the primary use of reclaimed water in this city. So from November to May, which is the dry season, there's an abundance of reclaimed water. Nobody's using it. or sorry, there's a shortage of reclaimed water. Everybody's using it. And usually the utility runs out around April. Okay, so we also conducted 2 workshops. I won't get into the details here, but we built basically the model together. And I'm in the 3rd step here, which is refining the model, and I'll show you what I have now. So it looks pretty complicated, and eventually it will be more complicated because I will simulate it and add data and equations to every single one of those variables. But see that water is moving along the stalks here, and you have wastewater starting at the top stalk there, then flowing into the reclaimed water storage tanks if there's room, basically if there's any storage capacity. Otherwise, it's discharged. In 2032, there will be new regulations in Florida that require utilities not to discharge any wastewater if there is no hurricane or no reason for them to do so. They can only do up to 10 days per year of wastewater discharge. So that's going to be a major problem for this utility when they're discharging currently about 90 days per year. That's going to be a huge hurdle for them. I also have potable water in this system, which you might wonder why I have that in this model that's about reclaimed water. But it's because all of these variables are also very important, because organizationally, this utility is having trouble managing its annual water permit withdrawals and complying with the Southwest Florida Water Permit Management System. So there's some organizational challenges for sure. And you might think, oh, sorry, there's also some feedback loops emerging, which again, it looks like I'm running out of time, so I'm not going to touch on these, but these informational flows in the middle, everything that's connected with blue arrows is also very interesting and important. And these feedback loops can tell us if there's any spiraling behavior or if there's self-correcting behavior. And these are balancing feedback loops, so they're not spiraling amok. But if there were reinforcing feedback loops, I would show you them. But luckily, there's not. It's usually a sign that something's wrong. These would potentially be the only really important variables if you're looking from the outside of the system and not using system dynamics modeling. You would think total demand, total supply. That's all we're looking at. But actually, I can tell you that all of these are also very important because we're looking at resilience of the system overall. Organizational resilience, all these things I talk about, managing the water permit, the water withdrawals, the number of days of discharge is important. Also, the social acceptability and the favorability of people connecting to the system and wanting to connect to the system, as well as the ability for this utility to make money off of the system and remain economically viable. That's also really important, right? So the next steps for me and this utility are to go ahead and, well, first I'm going to do a lot of back-end work and leave them alone for a little bit, for like 6 months. I'm going to test and validate this model, add those data and equations to it. And then I'm going to sit back down with them and we're going to create some scenarios together of ways that we can solve this problem, which might be interconnecting with another utility to get some of their excess wastewater and then also offload some of the excess wastewater back to them, or also finding new scenarios for discharging excess wastewater. So we're going to edit the model a little bit, and then we're going to recalibrate and find out where are our resilience benchmarks now. So modeling resilience as in the situation as is, as well as in the future. So the takeaways again, as I showed you before, it's accessible, it's underutilized by utilities, and it can produce clear actionable outcomes, as I've seen in my case study in Accra. It can be really simple to do. You can just do it with sticky notes on a whiteboard. You don't actually have to add all this data, but the more data you add, the better insights you'll get. And you'll also have system strengthening and capacity building with your teammates along the way. So thank you very much.
Thank you. I think we have time for one question for Elizabeth.
Question. Hi, I'm Emily from USA, and I'm wondering, it sounds like for the Tampa Bay example, you are still in the process of working with utilities to come to some decisions using the model. I wonder, did you say in Accra that the findings from the system dynamics model actually led to decision making? Because that's always seemed to be the big challenge with these projects.
Yes, great question. Thank you for the question. I would say partly yes. I have findings. Have they led to decision making? Question mark. The utility there is aware of the findings. I wouldn't say that it's concrete whether they've led to actions, because the actions or the recommendations that I made to the utility were to basically stop reducing service or days per week of service to the informal settlement. Because every time they did that, they end up kind of kicking themselves because the legal vendors who were operating in that system would end up suffering, financially suffering. And then illegal vending would kind of take over throughout the system through a series of feedback loops. So I gave that information to them, but it's very unclear whether that actually was a cause of, maybe if they have better water service now, I wouldn't be able to say that that's actually the reason. So hard to say.
Oh, and our last presenter for the first half of this panel is Grace Ferry. Is it Ferry? Perry, Grace Perry. Grace's research focuses on the critical issue of public toilet provision in the United Kingdom. So we're leaving the United States, which has seen a decline impacting citizens' health, mobility, and social equality. Her research raises important questions about the current UK public toilet policy and calls for more robust legislation to ensure sustainable, inclusive public spaces for all.
So I'll talk about the UK where there are no statistics about people without water and sanitation. So everything is perfect, right? So the UK is currently faced with a public toilet calamity. Public toilet closures, some are being sold off by local authorities to raise money. Some are being closed because local authorities cannot afford to maintain them. And the government is saying they've got no money to put into public toilet provision. So that leaves some cities with very limited public toilet provision, and some cities like Leeds, which is the third biggest city in the UK, with no public toilets at all in the city centre. So my study focuses on the domino effect of not having these public toilets in public spaces, how policy or lack of impacts this provision, and how that impacts especially marginalized groups like unhoused craft sleepers who spend most of their time in the city centers. So Leeds city centers had a few infrastructural changes from the 1800s, where there were no public toilets, a few cholera outbreaks, and then there was this massive sweep to clean up the cities, and local authorities were basically told to clean up the cities. We don't want this happening. And then there was this massive buildup of beautiful public toilets, nice architecture, most of them underground. So, and then comes the 70s, 80s, departmental stores, swanky cafes, more toilets, so to keep women shopping more and spending more time in the city center. And then in the mix comes the shopping malls with more toilets, and then the developments of infrastructure bringing bus stop, bus hubs, transport hubs, train stations, more toilets. So as all that infrastructure is changing, the local authorities were also slowly transferring responsibilities onto these private businesses and onto these without actually negotiating with them. So in the UK came this phenomenon of, there's all these publicly available toilets. So don't worry about public toilets. You don't need them. You've got plenty of places to go. So that's where I started. But if there's all those places where people can go, how come we have all those problems where people are complaining? There's various media in the last decade where people have gone into all these toilets and the staff has said, no, you can't use our toilets. And then it's people that it's those horrible staff in McDonald's, they wouldn't let me use the toilet, but no, you're not entitled to use them. You're not their customer. They haven't been told, they don't know anything about it. So when I looked at all that, my first thought was to look at policy to say, what does policy say? And there's no policy regarding public toilets in the UK. So I looked further, and then I went back to a very old 1936 Public Health Act, Section 87. That's the only legislation in the UK which mentions public toilets. And this has been updated a few times over the years. And in 2008, it was updated to include the Sex Discrimination Act by removing free urinals from somewhere there. So it's not there, but that didn't actually mean anything because there are still free urinals in the city center. So I used the institutional grammar tool to unpack the language of that act and how that affected provision. So it turns out it's a norm-driven legislation, and bottom line is the government, the local authority, have got no legal obligation to provide public toilets. So how does that become a problem? And then as I went back again to say, oh, okay, if we've got all these problems, all these toilets, do they really exist? So I did a street-by-street audit of all these publicly available toilets in the city center. And yes, they do exist. I found 301. That's a lot of toilets, right? So why are we complaining? So on analyzing the data, the first thing that came up is none of these are open 24 hours a day. And between 9 p.m. and 9 a.m., there's nothing. So you can't pee. And the second thing again that came from the analysis is 98% of these are owned by the food and drinks business, which means they are very customer based. So, and most of them are, if you're lucky, depending on who you are, negotiated access can be possible. And then on further looking at this, on accessibility only, at first glance, we realized that almost 80% gone because of accessibility issues, like some of them have got security at the entrance, and the opening times are very variable, like clubs open at 4 p.m. and close maybe about midnight. So you've been waiting from morning until 4 p.m. to go to the toilet. That's not possible. So in actual fact, what we were left with was like 20%. But on further reviewing the accessibility of this 20%, we also found that some of them were like upstairs on the 4th floor. You can't access them. And some of them, the cubicles were too small. People with wheelchairs or disabilities or a mom with babies could not get in. So all these accessibility issues were like, I was self-assessing, and I'm talking about the general public, you and me. We're having these problems. So now talk about an unhoused rough sleeper who is in the city center. Where do they start? So I think the research itself shows that there is very limited access for unhoused rough sleepers when they're in the city center at any time, whether it's day or night, and especially at night. So what are the impacts? So the impacts on the city center itself is there's smelly doorways, unsightly doorways. There's signs of open urination and open defecation. And the impact on the unhoused rough sleepers themselves. I've put what they've said to me on the poster. And the most touching thing about it is when they said of how it made them feel. They've got no voice. They don't know who to tell because the policy itself doesn't give anyone responsibility. There's no one responsible. And if someone comes and says, I want to pee, I want to ask, but when I ask, it makes me feel like a dog, then you know that we've reached the bottom of humanity. So that is currently the state of the UK. So in conclusion, I would like to say that the UK government is signed to the Human Rights to Sanitation, and it's in breach. And also, maybe addressing this, we need maybe more robust policies which can protect the right of citizens and sustainability of sanitation, not only the UK, but the future of all growing cities. Thank you.
Yeah, thank you very much. I think we have time for just one question. There's one in the very back there. Nice, thank you.
Thank you very much. It blows my mind that in the UK we have no complete right to sanitation. That's completely crazy. And I guess my question is, like, what if you could make any change? What would it be? And where could you learn from in the UK? Like, where would be good practice?
I think at the moment, the starting point would be a policy which gives responsibility and accountability to someone, at least. And then after that, we can have the building blocks of telling that person what we want or where to start. Because at the moment, the UK is like, give us a pit latrine in Leeds city centre, seriously. Yeah.
So, thank you, Grace, very much.
I'm on poster 9 if you have more questions.
I want to thank the presenters once again for their incredible work and insights into sustainable finance and governance solutions. And I'm looking forward to continuing to explore this topic with an esteemed panel for the second part of the session, which Dr. Al-Khattabi will facilitate.
I know it's the top of the hour and people have been sitting for a while, so maybe a couple minutes for a bathroom break, and then we'll reconvene while give some time for the panelists to join me up front. Excellent.
Maybe a chair over there.
Oh, yeah.
So have federal, state.
Yeah, it's nice.
Do you need any help? You want someone to run a mic for Q&A? Yeah.
There may be opportunities for questions. I mean, especially given the discussion, it seems like some of the panelists or some of the presenters may want to ask questions.
Okay.
It would be super useful if you could.
Okay. No, I was saying just because they will be here, that's one mic, so you have to.
You want to get our audience back in. Now they, between
I don't think we need to share the screen.
yeah, it's a lot of- it's just like contemporaneous or-
There's no waiting. So we. Very recently, and I worked with them, like, kind of like that, and like.
I want to be respectful.
And so.
Like hearing.
David, this is your.
We're just writing a blog on it and hoping like, oh, Mary should know the answer, and I was like, oh, she's here right now. So I'm just gonna go ask her.
Right here. They won't be far.
It was eight.
I'll actually, hunt just a little bit.
Yeah.
Okay.
Yeah, that's really.
I'll try to leave that. I didn't know water. I was using it to time myself.
Maybe it's not on. It says it's.
Yeah, so we any community water system that's. I'm sure. Gotta go this one. Yeah. 3,000 population. Okay. So, yeah. No, we got to see.
Now I'm terrified, like, I'm gonna get a dry mouth or something.
Yeah, I've never.
Oh, okay, thank you.
You guys might have an easy audience.
Yeah.
Just waiting.
The one-on-one.
Yeah. Yeah, say hi. Yeah, okay. Yeah.
We lost our audience.
Yeah, good job, AR.
Oh, no.
Honestly, in good faith, I couldn't let people not go to the bathroom after a talk about.
Yeah, right. Not shaming here on sanitation.
So I lost the audience on account of that.
Yeah. You're at least in
I'm at
good
least-
audience.
At least I can sleep at night.
They don't want to stay, but how much are they able to do?
That research topic had to have a personal experience, like, I've gotta go. And there's no.
Or your kid has to go and there's nowhere that you can go.
I mean, I feel that way in New York. It's like, I have to plan the bathrooms.
I was never trying, my dad would be a huge fan of that research, because he, like, anytime we're like trying to work, and this has been my whole life, like, anytime we're like wanting to do something, he's like, what's the bathroom situation? He's gonna be able to go to the bathroom. He's been a hyper friendly. Yeah, we always have to go to the bathroom.
Just touch on the whole like pain.
The question about, you're sending deliverables to Haley today.
Did I get the email yet?
I'm telling you right now, they're ready.
Our first,
Do you need me to send to you or not?
Yes,
should be convinced. that
after,
she has-
after this, I'm gonna go back to the office and
We have like field inspector line, she does not.
I'll send it to Haley.
Let her galvanize line, but she also, she's like, she's convinced that she has a galvanize
You hadn't sent them yet, right?
to be.
No, they're just ready in the folder. So if you want them in an email, you just.
If you don't mind, if you don't mind sending it to me,
Then you
email,
can
because then I
forward.
can just,
Yeah.
yeah,
Interesting.
that also reminds me to do it.
That's the result, right?
Yeah. We have 108 galvanize required replacement, because we can't, we don't have the records to go back to say that they were.
All right, we'll wait for another 1 or 2 minutes and then we'll get
By
started.
the way, hi.
Yeah, nice to meet you. Yeah. Are you based in the southeast or are you in DC?
This is complicated.
This,
My home office
yeah.
is the DC office, but I physically reside outside of Atlanta.
Gotcha. You're familiar with Rican Boys?
Yes, I used to work as a for a
Okay.
while. For years, yeah.
So you don't report into the regional.
Well, so if I reported in, I would report into the DC office, but I do not do that. And a lot of the staff on Norfolk is remote, so I'm not like missing out on the office interaction. It's kind of like we're all spread out across the country.
Yeah. I think Jackie is like that.
All right, well, in the interest of time,
Jackie.
Sure.
Your EPA here for a while.
Can everyone hear me if I talk like this, or should I lean in more?
Lean in.
Lean in more, okay. All right, so we'll go ahead and get started. First, I'll just acknowledge the fact that everyone left, but in good conscience, I had to let everyone leave after a talk about lack of bathroom access. So at least I can sleep at night. But on that note, I really do want to thank the first set of speakers. I think each and every one of them did a fantastic job characterizing a lot of the issues that we're facing in the US and also setting us up very nicely for this panel. I'll start with an introduction. My name is Dr. Ahmed Rashid Al-Khattabi. I'm the interim executive director of the Environmental Finance Center here at the University of North Carolina. We're a technical assistance provider. We also do a lot of applied research. We're actually very similar in nature to one of the the speakers, RCAC. We also provide a lot of public resources and work with a lot of utilities that struggle with technical, managerial, and financial issues. And we do a lot of work with smaller systems. And I think David did a fantastic job of overarching, characterizing the overarching issues in high-income countries and the expectation, especially in the US, of utilities operating as independent financial units. And given all the challenges that you've heard during the plenaries, you've heard during the previous talks, the challenge overall is daunting, and the funding is not there given the need. So we have an esteemed panel of representatives from different levels of government and government adjacent. And I'll pass the mic to all of them to introduce themselves briefly, but we have someone from the federal government, someone from state government, local municipal, and government advocacy. So I'll turn it over to them to introduce themselves, and then I'll start asking questions.
Thank you, everyone. Jean Ray here with EPA. I'm with the Water Infrastructure and Resiliency Finance Center.
Morning, everyone. I'm Shadi Asghar. I'm with the North Carolina Department of Environmental Quality. I'm with the Division of Water Infrastructure. I'm the director there. And my division is the one that provides a lot of funding to a lot of local governments. Happy to try to answer questions from the rest of the regulatory side of the EQ, but I can't promise I know all the answers there.
Hi, my name is Mary Tiger. I'm the Director of Community Relations for the Orange Water and Sewer Authority, which is the water and sewer provider in Chapel Hill and Carrboro. So you're drinking Owasso water now.
Hi, my name is Grady O'Brien. I work for a statewide nonprofit called the North Carolina Conservation Network. I particularly work on water quality, regulatory, and funding issues. I'm also a lobbyist, so I spend a lot of time at our General Assembly. So thanks for having me.
All right, great. Well, now that we're all friends, I'll start with asking the hard questions. And I'm going to start with, first of all, I'll just acknowledge how great of a moderator Aaron Salzberg was during today's plenary, and I can only hope to be half as good. All right, so we'll start with something timely. We'll talk about hurricane, especially Hurricane Helene. So Hurricane Helene devastated much of Western North Carolina and caused extensive damage to many water and wastewater systems in the region. In close succession, we had Hurricane Milton, which bore down on Florida and wreaked havoc. And these specific events, you could characterize them as unique, but we all know that they're not, and that they're expected to increase in severity and frequency. But after each of these events, identifying needs that affect water and wastewater systems, and then coming up with the financing to address those needs is not only daunting, but also extremely expensive. And it's a necessary task. So what I want to ask the panelists from each of your vantage points, what is the role of your organization in working towards helping these systems become resilient? And what do you see as the challenges in recovering from similar types of disasters? Who would like to take
I guess I'm going to have the most broad answer. So EPA has a range of grantees and cooperative agreements with TA providers, technical assistance providers that can help. There are the environmental finance centers, the rural, small, and tribal providers for wastewater. There's creating resilient water utilities. There's the environmental justice thriving communities and technical assistance centers, which we internally short to TICTACs, but I don't know if that'll catch on. There's specific engineering TA, there's specific cybersecurity TA. So there are a lot of options for all of these things, and anyone can request technical assistance on the EPA webpage. In terms of challenges, there's an urgency, of course, in these situations, and some of these funding sources, they take time to get off the ground. And In terms of available options, the state revolving fund can finance projects that include resiliency components. Some states include project priority points for resiliency. The Clean Water SRF specifically has the Green Project Reserve, which requires 10% of capitalization grants to go to projects that address green infrastructure, water or energy efficiency components, or other environmentally innovative activities. The SRF can actually serve as stopgap funding for some of these situations, assuming the project is SRF eligible, of course, and then can be repaid with FEMA funds, which may take more time to come. Of course, the state revolving funds are federal state partnerships, so Shadi will know probably a lot more than I would know about these things. And if you care to add there.
So again, I'm representing state government here in North Carolina. We are right now dealing with Hurricane Helene. We're actually meetings constantly happening. I'm getting text messages as we speak. So with hurricane recovery and resiliency, right now we're dealing with the recovery side of Hurricane Helene. There are a lot of wastewater systems out west right now that can't provide water or sewer service. The immediate work that's happening right now is to get them operational and to provide the most basic levels of treatment before we can think about longer term repairs as well. We're working with, so there's a role for state governments, a role for federal government, a role for local governments, and you hear from each one of us, and from people as well, from organizations that are supporting all of those systems. On the state side, we're trying to make sure that we can support what the federal government is doing right now, like FEMA or the Army Corps of Engineers, as well as the communities on the ground. So we're acting as the bridge between federal and local and providing some assistance. On the financial side, as you heard, sometimes it does take some time for finances to become available. So a lot of these systems are facing several $1 million worth of damage. And if they haven't built a reserve to be able to pay for that on their own, they're going to need some funding assistance. So what we're doing here in North Carolina, we're using our state funds. So in addition to state revolving funds, which we do manage, we also have state funds and we're making those available. As an example, right now, we are trying to provide some emergency loans that then FEMA will be able to reimburse later on. So we're basically providing cash up front, not up front, but cash available right now for the systems to do whatever they need to do until FEMA money does come in and reimburse them for that. So in the end, they don't incur the costs. But we try to provide that funding now so that they don't have to wait for FEMA assistance down the line. There's a lot of things that happen on the regulatory side in these kind of situations, which I won't be able to speak very much about in terms of, what happens when a wastewater system is not able to treat their sewage and they're just discharging untreated. So there's some things that the department and the state has to do to accommodate for emergencies. Longer term, though, as you heard, resiliency is really a key part that the state agency focuses on as well. So we do prioritize projects that builds resiliency into a project. So move infrastructure out of floodplains is one example. I know we could probably do more on resiliency. And we're as we go, we learn and try to do as much as possible. But there's a recovery and resiliency aspect that we try to handle.
Maybe Mary can touch on what else you can do.
So I can speak, so with Hurricane Helene and the local government response and building resiliency or being resilient. OWASA is a member of a network of utilities called NC Water Warren, but it's a national group, and Warren, I should have written down what that acronym stands for, but it's a readiness and network that stands ready to assist other utilities with any type of emergency situation. The network in North Carolina, this Hurricane Helene is kind of testing it in a way that has not really been utilized before in the past. In the past, it's been kind of a one-to-one assistance. One utility suffered an extreme event, needed some assistance from a neighboring community, asked for help. And that Warren network, by having the agreements in place already to assist and receive reimbursement for assistance, we're able to respond very quickly. Hurricane Helene is a many-to-many type of assistance. And really, it was asymmetrical for the first couple weeks of that the utilities that wanted to assist and respond, the unaffected utilities that were like, put us in, coach, like, we're ready to help, we're ready to assist. Far outweighed the number of utilities that were ready to ask for help. We're starting to see that shift a little bit now. But I think from a resiliency perspective, to be able to think about that larger network of professionals, and what, you know, we're not necessarily talking about the engineers that can go in there. We're talking about the field crews that, you know, mobilize equipment and repair the water lines, that can, that we can send equipment up there to field inspect, you know, sewer pipe and clean it out. So that's been the assistance that we've provided this far. And I think the state is going to be stronger for this and that network, building up that network. I would say, as, you know, a utility professional, it's certainly warming to think that if something like that happened here, that we would have, you know, utilities being able to step in. You know, from our standpoint, from the, you know, OWASA standpoint, I think we try to take any sort of project that we're approaching and stress test it against, you know, any type of impact that it might have, whether it's cybersecurity, you know, climate change, any sort of stress that might come. And as we're making those investments, making sure that we're making, you know, plans for resiliency. So, you know, love to hear that, like, the funding is looking for that type of resilience to be built into these big capital projects, because they're slow to come on. And so I think that's the challenge, but, you know, and somewhat the opportunity is that this big infrastructure beast train, you know, if we can start to embed that into our decision making, over time will become more resilient infrastructure.
Yeah, and I guess from kind of the non-governmental perspective, we're kind of the outside agitator, right? So we're, you know, always pushing for government to be mainstreaming resiliency in its decisions. And so, as Gene and Shadi alluded to, you know, they right now have resiliency factored into their programs in certain ways. And I think sometimes it's just us pushing about what's the next level to that and what could that look like. But also, you know, broadly, even outside of water infrastructure, you know, recently the state updated its uniform floodplain management policy. And that was, I think, because advocates had pushed for that, and then, you know, participate in the process of what that should look like going forward in a changing climate. There's also a flood resiliency blueprint being developed by DEQ that came out of the legislature, and pushing for, supporting, and kind of participating in the technical process to, again, make sure that this is going to become something functional and useful to support decisions across, you know, not just DEQ, but DEQ when they're building roads, Department of Administration when they're building buildings, whatever it is. Kind of taking that big picture approach to, you know, using the whole of government for this, and not just saying, well, you know, it needs to be factored in one place. It is broader than that. And so we're kind of the folks that maybe try to connect those dots for people across government.
Okay. I have another question, but before I jump to the next question, I just want to say something that I should have said up top. If there is a follow-up question from the audience that you would like to, I would like to make this interactive. So if you do come up with a question, please feel free to raise your hand. And if you're online, I'm actually looking at the chat. So if you do put something in the chat, I will see the question.
I have a quick question, because I work with a group that works as an EFC. So, and its goal, it's called Moonshot Missions, and its goal is to provide a technical assistance free of cost, with getting EPA dollars to communities that need it, right? And one of the things that I'm always hearing and constantly dealing with is that even so, the communities that most need the help are the least able to apply for it, right? And when they are going through these periods of extreme stress, as they are in North Carolina right now, even though you might have significantly more dollars for them, their capacity is even further reduced. So in these periods when we can rebuild back better, we can do all of these things. I don't have an answer. I'm not asking you, like, what do you do with systems that are so stodgy? I mean, you're saying, oh, the time takes a little while. It's not, I mean, these grants take forever to come through and EPA's expenditures, they're saving their grant expenditure of the monies that they put aside is so much slower than their SRF outputs because they can't approve them fast enough, right? They don't have the people to approve them fast enough. So I'm just thinking.
Let's keep the questions brief. Let's keep the questions brief.
Sorry, what do we do? What do we do? It's my fault. I never ask questions like that. I'm killing myself. I'm sorry, I'm embarrassed. What do we do?
It's a really great question. Absolutely valid. That the smaller systems or those that are most challenged are usually going to be even more challenged.
Yeah.
During these times of crisis. So we're trying to, I can only speak to what we're doing right now. As an example, we're not waiting for them to apply. We're basically preparing, and we reached out to them and said, just tell us that you want the money and we'll help you apply for it ourselves. We will do the application for you and just send it to you. But we need them, the local governments, to submit it to us. So we know that they're asking for it. So we're prepared for you. We'll send it to you. You just check it, send it to us. And we do work with partners too. So you heard Water Warren, for instance. There are lots of utilities and consultants who are volunteering right now out there helping those systems. And we also lean on them a little bit too, and they're there to support the situation. So I'm not sure about technical assistance providers, but I think that the consultants and the utilities out there are helping each other, peer organizations helping each other. And we're trying to streamline that. That's the reason why we're also trying to look at providing funding first before FEMA comes in, because like you said, it takes a while for some of that funding to come through. So anything we can do to try to provide that initial funding now and make it as cheap as possible, as easy as possible. That's how we're trying to help those small systems. Now, there are also a lot of smaller privately owned systems, which unfortunately we can't fund. So what happens with them is that they are being connected with the Army Corps and FEMA, and the state department is trying to direct that assistance, the Army Corps and FEMA assistance right now, to those systems as well. They need a package plant right now because their sewer system's not working. Let's get them to put a package plant in there, and FEMA will cover those costs. So there is some of that assistance and some of that attention going towards the smaller systems. But it's always a challenge, and they're always just too busy. They can't even answer the phone calls anymore because they're getting so many people calling them saying, hey, we can help. And they're out there trying to turn on the tap and trying to make things work. I don't know if anybody else wants to answer.
I mean, I'll take a stab at it. I believe some of the technical assistance providers are supposed to kind of do that support and help communities apply, but I mean, that's absolutely good feedback, especially from a technical assistance provider, that there's this, this large gap and it's not being met. I think it sometimes becomes a little bit more complicated than just getting the application in, because a lot of these small systems aren't eligible for certain reasons. They may lack TMF capacity. They may have 10 years of municipal financial audits that they're delinquent on. And, depending on what the state requires, the requirements vary. So part of that piece is helping communities become eligible. So sorry to further complicate this, but I also wanted to mention that. Sorry.
Yeah. I'm gonna add on to Jean's, the front work that needs to happen, but then it's also the ongoing work of managing those funds and keeping up with the paperwork. And so it's really kind of a cradle to grave level of assistance that is needed, because it's a higher level of paperwork and requirements than is needed. So even once you get the funds, as an entity that applies for SRF funding and grants, we're fortunate to be in a situation where sometimes we're like, it's not worth it, right? Like there's a certain level of funding that it's just really not worth it for us to deal with it. And so on a smaller system where there's, less capacity to deal with that, it's a whole comprehensive level of support that's needed.
So, great, if you want to answer, otherwise I'll go to the next question. So I'll just piggyback off of your question and talk a little bit about it, or ask a question on affordability. Right, so you talked about costs, and there's even more costs coming down because of regulatory requirements and so on, and all the infrastructure investments that need to be made. So from each of your vantage points, what are some of the ways you see utilities making these necessary investments, but at the same time supporting their customers being able to afford the services that they're receiving?
So on that side,
Oh, I guess it's, I mean, you know, from kind of the outside perspective, we have a great program in Shadi's unit called the Viability Utilities, and that's trying to get some of these places back out of kind of an economically distressed scenario where they can more long-term sustain what they're trying to do. I also am kind of an advocate for consistent state funding, non-earmarked state funding that can get to these utilities. I mean, you know, in the ideal scenario, each one could sustain itself, but we know that, you know, over time, these are just such huge capital expenditures and such expensive systems that, you know, an influx of capital from the state or federal level every so often is going to be necessary. That is happening at times, but a lot of times it you know, goes through the process and there's political earmarks and that kind of shapes away what could be necessary funding to make it to some of these systems. So I think, you know, as sustainable systems as possible on the one end with consistent and non-earmarked funding as kind of an infusion when it's necessary, I think can help towards affordability.
So if you've driven around Chapel Hill very much while you've been here, or know anything about the area, you would know that it's a fairly affluent county and area. And so our issues with affordability are, you know, are different than some of these smaller systems that we're talking about. We have kind of a system limitation to being able to address affordability in our community, and that statutorily we're not able to take ratepayer funds and use them for rate relief or rate, you know, bill assistance. And I don't know, honestly, that that's necessarily a horrible thing when we look at what's kind of happening in other communities where they are providing discounted rates for low income households as an opt-in program. If folks aren't opting in, they're effectively paying more for their water and wastewater services. So there's definitely some work that needs to be done on that local assistance. I would say the federal assistance program during the COVID times, federal government set up a temporary bill assistance program, the low-income household water assistance program, which was put to great use in our community and across the state. And I think there's a huge role for that moving forward as we see, you know, significant investments in water and wastewater infrastructure is needed. Bills are going to become less and less affordable. And just like there's an energy assistance program, I think we need a federal water bill assistance program. It would be nice to have the legal autonomy to do a little bit more on the local level as well. Maybe that doesn't look like rate relief, or maybe it's not an opt-in program. But those are some of the things that we struggle with. And as we look at the significant amount of investment that's needed to address emerging contaminants, lead service lines, that type of thing, it's, you know, the forecast doesn't look good from an affordability perspective for water and wastewater services here.
I guess before I go into my answer to that question, I'll also just provide a little context. In this country, publicly owned utilities usually are not regulated on the financial side, and rates are not regulated. In other countries, that could be a central government decision. But here in this country, most of the states don't have that. So in North Carolina, rates are not, for publicly owned utilities, are not regulated by a state agency. So it really is a local utility by local utility decision on what the rates are. But the state does still have a role. What we can do is provide the funding that we are managing, that we're able to provide to the utilities. Even though the state can't fund all the systems all the time, we don't have that. The vast majority of funding and vast majority of the expenses for the utilities are covered by the ratepayers in North Carolina. The state provides a little bit of funding but it doesn't support all systems, all systems needs. But what we can do is prioritize where those funds go. So our funds are subsidized funds, and that's what we do. We try to prioritize who has access to our funds and what additional subsidies can we provide to those that are most needing. And by providing those kind of subsidizations and prioritizations, our aim is that we are trying to help the systems that need help the most, so they can keep their rates manageable as much as possible for their communities. We do that at the system-wide level. We assess the whole system, but we also now, for the past couple of years, have been trying to direct some of our subsidies towards even the larger systems that are in affluent communities. We'll pick on Owasso, sorry. Owasso is an affluent community, so they wouldn't necessarily get the subsidized funding from us. But if Owasso or a similar utility would focus their project on an area that would benefit a disadvantaged area within their community, then they can get the subsidies from us as well. So we're trying to direct both at the system-wide level as well as the beneficiaries level, if you want to look at it that way.
Yeah. So I think in terms of keeping those costs low, there are certain best practices that can be followed. I want to tease a bit of a FACA product that should be coming out soon. The Environmental Financial Advisory Board is going to come out with a water affordability document that will have recommendations to try to keep those costs lower and just have innovative financing mechanisms, different rate structures that should help low-income customers. So that should be coming out soon. Also, in terms of keeping those rates lower, EPA has the Water Finance Clearinghouse on our website. It's basically a searchable database of financing options. So that's one more way to kind of keep those costs low. I think utilities are already doing a lot on this front. And before I say the following, I want to make clear that EPA does not control Congress, and we cannot lobby, and that is not something that we do, and we don't know what the future holds. But what we have been doing at EPA is working on a water affordability needs assessment. And part of what is in that assessment, and this is a report to Congress, is options to increase access to affordable water. And one of those options, potential options, is a federal water assistance program. So in that document, we roughly estimate the national breadth of need of water affordability, the water burden. And we kind of say, like, this is an option that would help. And we can just wait and see, I guess, what happens with that on the legislative side.
Back to me. So beyond the issue of, did you have
Yes.
Sorry, of course, yeah.
So you're saying that the public utilities here, they don't have a regulator, they can set the tariffs by themselves. So who are they accountable for? So if they're inefficient and they come to you asking money for some improvement, but they keep the service pretty bad. So if they just improve their efficiency, they wouldn't need the money from the state. So who are they accountable for?
I know you're looking at me for that. I'm happy to answer that, but I think Mary might have some thoughts on this too.
That's because of the funding.
Yeah, absolutely. So in North Carolina, I'll just talk about this state here. The local government owned utilities, the publicly owned utilities, who regulates them is basically the local elected officials. So the city council or the authority board, they are the ultimate decision makers when it comes, and they're the responsible decision makers for the financial management of the utility. When they do come, when a local government applies to us, we prioritize not just where, we can determine from the application whether or not they are in a financially challenging position where they need that assistance. But we also try to reward good system management as well. So if you are doing the things that you're supposed to be doing, your application can score higher as well. So we're trying to avoid that situation where we're funding bad behavior. We're trying to fund well-run utilities that just need the money. And then we're also, you heard Grady mention the Viability Utilities Program, which is a separate state-funded program, not federally funded. But for that one, we are focused on the local government utilities in North Carolina that are financially not viable long-term, or just utility not viable long-term, and providing a lot of additional assistance that goes way beyond the finances. So we help them. We train their elected officials. We train their utility, their decision makers. we help them create an asset management plan to figure out what their plans are. So we do a lot of additional work or help them to do that system management side to try to get them to that level. I think that you're describing, but that's my answer. Anybody else wants to add anything? Yeah.
Well, since this is a finance and governance, right? So Shai's right on that, it's up to the local bodies a lot. And at the municipal level, so if it's elected officials that are setting the rates, it can get kind of muddied along with, setting tax rates. I would just brag a little bit because I think that the governance structure that OWASA has is particularly effective for decision-making. So we are a special unit of government that's set up just for the provision of water and wastewater services. So our governing body's 9-member board, it's appointed by elected officials. They're appointed by elected officials, but they are not running for office, and they are exclusively focused on the management and decision-making for water and wastewater utility. And it's a very nurtured relationship, right? We have a lot of discussions. They understand the need for the rate increases, and we've had some pretty significant rate increases over the last 5 years. And it was never, it's rarely a matter of kind of making the case to our decision makers of why it's needed. It's more about understanding the impact on our community, buffering the impact on the community. So that's where a lot of the discussion comes to. So to the extent that that's a kind of a model governance structure for that type of decision making, in my case, or my observation, it has been quite nice.
So I'd like to come back to from affordability transition to access, and then after that, come back to this issue of governance that you're bringing up. So with access, affordability is a challenge in this country or in high-income countries, but access is also a challenge. I mean, there are folks in this country that have no access, some that are on decentralized systems, and some that are on centralized systems. But there's a daunting challenge of figuring out ways to connect those who have not been connected in the past, and there are also challenges with those who have some form of access already. You can have households on wells and septic that are failing, and then not all people that are connected to centralized systems are actually getting the quality water that they're supposed to be getting. And I'm not talking about OWASA because OWASA is doing really well. So no offense intended. But in your minds, what do you view as the hurdles to providing households with adequate service? And if you want to also talk about challenges or opportunities and solutions, you're welcome to do so.
Sure. So I think there's a few ways of looking at this. There's, people who maybe should have been connected to a system, but weren't just because of, historical, discrimination. And we've seen things like that in North Carolina. And Shadi made the case that, they have a eligibility for more affluent systems to connect neighborhoods like that might have been historically disadvantaged and left out. Now there's places that, maybe it wasn't feasible way back when they were built, but because of, density or whatever's happening, they can connect to a system now. And same thing, that's just kind of, do you have the political will to, get a system to connect you? But I think the last part that Aaron mentioned, the folks who are on private wells and septic, there's kind of there are borderline cases where maybe it doesn't make sense for them to connect, it just never is. And I know advocates are thinking about what do we do for those folks who are kind of seen as on their own, that you have to fund your own septic repair replacement, you have to fund your own well, because those things have environmental impacts beyond just what the individual user is exposed to. And that can be really important for the state. So I think one hurdle is making those kind of folks who it's not going to ever make sense to run a water line or a sewer line out to them, who need well or septic, but are bearing the entire burden of that cost, even though the effects of it, the externalities aren't only on them. So I think that's a hurdle, but it's an opportunity for us to make a case of, we spend lots and lots of capital money on centralized systems for, folks who are ratepayers and all that. Look at this other half of folks in the state who aren't really having that. So it's a challenge, but there's an opportunity there to kind of make the case for those folks.
So we went through a strategic planning exercise a few years ago, and in our community discussions around OWASA strategic planning, question was raised, what about unconnected, customers? And it had been considered the utility before, but not really, and not in a long time. And we're like, oh, yeah, we think about our customers a lot. We don't think about the folks that aren't connected. We have a policy, like many utilities, a growth pays for growth. And so the cost to connect to our system is typically, it's paid by developers, it's built by developers, and then it's turned over to the utility. And that's a fairly common model for utilities to use. And that works when you have a developer with deep pockets that can pay for that type of stuff. But for, a homeowner that the system has grown up around them, even when the lines are accessible to them, the cost of tapping into that system, it far outweighs the cost of repairing the system. So we went through an exercise of trying to identify those customers that were not connected to our system, but were within our service area. That was kind of difficult. And then trying to get funding so that we could offer them extension of service. And we've hit a few barriers in that. And I think one of the barriers, is kind of the readiness to connect. We were just talking about affordability, and it's not a matter of like, if you build it, they will come. It's like when they're ready, they would like the option to be able to connect. And so the funding that we were looking at pursuing, and this is no offense to Shani or CDBG or anything like that, it very much required like a defined area that you're going to connect. And it didn't match the need that we were seeing in the community. So in terms of like solutions and opportunities, I think some sort of state trust, some sort of fund that's there to help those homeowners, residents tap into a system when and if they're ready, would be very helpful at overcoming that hurdle. You still have to deal with, now you have this ongoing bill and you didn't have an ongoing bill. But I think that lines up better with what the need than what we were able to really kind of access as a utility with the existing funding.
So we know in the state, there are lots of areas in the state that don't have adequate access. And there are some communities that are maybe lower income, disadvantaged areas right outside of the utility boundaries and don't have access. And it's hard to extend. You heard it's expensive to extend and connect. And the connection costs are a big deal. So the state doesn't regulate what the local governments decide as far as where they go, but we do try to incentivize providing our funds to do that extension connections. So recently we've been incentivizing folks or utility to submit applications to do exactly what Mary said, which is to connect areas. It is defined areas, so that is a challenge. A defined area, and then the costs to connect would be completely covered by our funding. So connect and don't charge the customer. That's fine. That works for some. But we're also seeing one of the challenges is a lot of times the homeowners would say, I'm interested in being connected. I can only do it if you connect me for free. Okay, well, we've made that possible now. But then when they find out what the monthly water and sewer bill is now going to be, they say, no, thank you. I don't want to be connected anymore. So that's a challenge there too, where it's getting that buy-in. It's getting like you heard from Mary, like it's when they're ready. And it's hard to build infrastructure when you don't know you're going to have those connections. So that is a big challenge, and it's a very difficult one to address. I like the idea of a trust.
Yeah.
So we're looking into that a little bit more as a discussion.
So I think y'all mostly covered it, honestly. But I think zooming out broadly, when you have people who aren't connected, some of them are quite happy with that situation, but I think there's a need for more research, particularly with private drinking water wells, just overtly stating that these are not regulated and how does that water quality kind of stack up against MCLs? On the wastewater side, there are hurdles with what technology makes sense where. If your soil doesn't percolate well and you're a long distance from centralized treatment, what makes sense and could be within budget. And along that vein, EPA has something called SCOUT, the Searchable Clearinghouse of Wastewater Technology. So that helps to be aware of the myriad of options available. The culture and practices of utilities can also affect this sort of thing. So we've talked about needing the community to be ready and willing. I've seen one situation where the state, not in North Carolina, where the state SRF was offering additional subsidy equal to what it would cost to get a disadvantaged pocket community connected. And the utility came back and said, well, our lawyers have indicated that we ought to charge everyone a connection fee. So it's sort of this, like, there's free money, the community's willing to actually pay the monthly rates, but they couldn't get those connection fees sort of covered. So there are complexities, and I know you're throwing your brow. So willing community, willing utility is important on the access and connection front.
So I know I said I was going to talk about governance, ask a question about governance, but the issue of trust kept coming up. And so I think I'm going to ask a question on that, and if we have time, hopefully we could talk about governance. But on the topic of trust, you talked about, utilities are self-governed, and they have a lot of autonomy, and everything. And the state can do certain things, the federal government can do certain things. But I am curious as to the voice of the customer. What role do customers currently play in decision making in that process, and should customers be more involved? And could that affect trust?
I can start with trust, I think. So our vision statement is to be the trusted partner of our community for providing water and wastewater service. So we talk about trust a lot, and I would say it is a particularly hard time to have that trust conversation with the community right now. It was really interesting hearing Secretary Reagan talk about the EPA and the grassroots community awareness around PFAS and how they're, kind of leveraging that as a policy window to advance some stuff, which it is very exciting. It was interesting to hear it from a strategic perspective, because as the utility, right, we're kind of stuck there. And it's hard to have that trusting relationship as the science and the policy is like rapidly evolving right out, in the plain air. So how do we have trust then in this very dynamic situation? Something that we have kind of embraced, and it has been hard to do, is this vulnerability with our community and our customers. We have had this series of PFAS community chats. I'll focus on PFAS, but I mean, I think it could be applied in a lot of different to a lot of different topics. So we've had these PFAS community chats. Shadi sat on one of them, where we bring in experts from the field or from across different aspects of government and entities, as well as some of our own staff, to have a sit down with our community like this. And there have been a lot of really kind of tough moments where we've had to say, like, we don't know at this point, talking about the future of PFAS regulation and how the technologies and what we don't know. We're trying to figure that out right alongside of you. And from a lot of my colleagues, that's been really hard. We're used to being an authority. We're used to having it kind of figured out and talking to the community about that. So I think kind of at a local level, being a lot more like open and vulnerable to those discussions and kind of working it out with the community. We've seen kind of a positive impact of that, but I wouldn't say that we have it figured out. Yeah.
So in terms of decision making and getting customers, I think that's an important thing, and I think hasn't been used at the state as much as I would like it to be. So it's something I've been trying to kind of crack that nuts a little bit more to. How can we get how can we get in front of community-based organizations, just like we saw that presentation at 10 o'clock? And speak with lots of different community-based organizations to hear from customers directly. Because we, at least in my division, we deal directly with local government utilities, or the utilities or the consultants. We deal with the people who handle the infrastructure. But to hear from their customers directly what their needs are will be helpful for us so that we know how we can prioritize, how we can structure our funding programs to try and incentivize what the customers are also looking for. So trying to build that bridge as well. Right now, we rely on the local government. So a lot of times if we do get talking to us, we say, these are great ideas. You have to go to your local government, sit down in your city council and talk about what you need. Let them know, raise the awareness to your local government officials so they can then submit, apply for or create a project that will address your needs. Because we don't have authority over that. However, we can try to incentivize further those conversations between local governments and customers, and for us to also hear what people might want as well. So I think the role of community-based organizations, I think, will be important in that, how the state and customers can work together. Adam wants to talk next.
So it's certainly going to vary how much customers are involved and at the table at each situation. EPA has what we're calling an augmented alternatives analysis program, which is basically it's a way of engaging the community and understanding the community's priorities. So this is an infrastructure planning process that improves the traditional alternatives analysis. It's really focused on solving the issue while optimizing the outcome for the community. And I think in water, we tend to talk a lot about compliance, but this part of the point of this program is compliance should really be like the floor of what's being provided. So rounding out, nothing. Okay.
So we've got around 6 more minutes. Are there any questions from the audience? If not, I'll ask another question, but I just want to make sure that the folks. Okay. So I'll ask a question about governance. So we talked about how water systems in the US are largely expected to be self-sufficient, but there are other governance structures and different models out there. We heard from Kate Sawyer earlier about regionalization as a potential option. So I wanted to hear from you all. What do you see as different models for helping water systems be self-sustaining in the long run?
Brady, I'm going to take a question.
I mean, everything I'm about to say, I'm shoddy, but no, I mean, the kind of field problem of North Carolina is we've got 500 some local government utilities of various sizes and lots of them serving less than 1,000, less than 500 customers. That's not, if I handed you the state of North Carolina and said, come up with a water utility system, you wouldn't be coordinating out groups of 500 people. You'd be doing it at a broader scale than that and kind of thinking about, more holistically than that. So the fact that that's just kind of how these things naturally popped up around industry and population centers of the past that have now kind of hollowed out, maybe, that's kind of the problem. And some of these places, maybe there is a strategy to get them to viability on their own, but merger and regionalization in its many forms is probably going to have to be a part of that. And, it's not all just, merging systems together to be one. Sometimes it's just, maybe a different source of water. If your water is really expensive, there's a lot of different ways to do regionalization that isn't, giving up a system, because I know that's really politically hard to do. Although my folks live in Pittsburgh and they just sold their water system because that's what was best for it. So it kind of takes one, looking at the map and realizing that, there's going to be some tough calls of places that are going to need to think differently. And then two, finding that political will to enact that solution.
Sure. I think regionalization or consolidation should be, an option for those who are open to it. And I think a lot of us are probably aware of the benefits or potential benefits like economies of scale, increased TMF capacity, improved emergency response. improved customer service. So there can be benefits, absolutely. Just to reemphasize, as pointed out during a previous session, it's really kind of a range and there are a lot of different ways to do it. So you can stay physically separate and pull specific resources like administrative resources. Of course, there are funding sources for small and disadvantaged communities. The SRFs are required to provide a certain portion of additional subsidy from capitalization grants to disadvantaged communities. And I'm just gonna like quietly hand off to Shadi on that.
So what we're learning, trying to work with the viable utilities program within the state, is that long-term viability can look a little bit different for each one. There's a master plan that the State Water Infrastructure Authority created back in 2017, and it's all about viability, the long-term, the need for the utilities to be long-term sustainable and viable, which means a lot of different things. You know, one thing is you don't rely heavily on grants. Grants are not always going to be there to bail you out. You need to be able to self-finance your system, or you can't do that if you don't have a lot of customers. So system size, regionalization, all those things. You know, I'm not going to keep repeating the same things you all heard, but there's also the other side too, or in some situations, there might not be a regional option. You're a small system and you don't really have a regional partner nearby that you can use, you can rely on. You might want to take a hard look and see whether you should look at decentralization. Maybe that's another alternative to be considered. Regionalization for systems, it's not just a economies of scale, which absolutely, I mean, that is a huge benefit. It's also the political will to create that regional option. And in some situations easier than others. It's a long-term struggle to get to that viability question. But it also takes creative thinking and networking and connecting the right people to build what the right solution is. In some situations, you can actually, as your own system, be self-sustaining. Lots of systems are in that shape. It's harder for small systems to be in that shape. And that's where we're looking at regional options. I was interested to see the New Mexico presentation a bit earlier that talked about an authority that was created to manage multiple small systems that were, individually managed by themselves. That's a model that's out there as well in other states. So it's just, there are a lot of different ways of doing this. In the long term, it all comes down to, let's take a hard look at the situation that you're currently in and what are the creative solutions. And I don't think any one specific model is going to always be the answer to everybody.
It also takes trust. I mean, that's also, did you want to respond as well?
I don't, I have some anecdotes and stuff from the utility perspective that I could share, but kind of reflecting on this, the kind of the governance thing, and then going back to the first question about Hurricane Helene and this like NC Waterborne network and seeing the capacity that's in the state and even beyond to kind of surge and help a smaller community, a smaller system address some need that's not necessarily like geographically adjacent. Because in my little head, like, oh, regionalization, it takes like geographic proximity. I'm not, it'd be interesting to kind of, I want to think about this some more. And so I'm going to give it to you to think about some more too, about how we can take some of the, larger systems and the capacity that we have that's maybe not geographically adjacent, to help provide surge resources for smaller systems. I think there's a private system up in the mountains right now that they knew where their water lines were broken. They knew what was going on. They just needed somebody to come in and help them itemize, like put it in the FEMA talk of what they needed to ask for. And then they just needed our crew to kind of go up there and fix the pipe. And then they're like, okay, we're good. Now, do they need to staff up? Do they need like an official contract to always be ready to do that? Probably not. But could they, in the future kind of call on us and be like, hey, we're having this issue. Could we like borrow a crew for a week or 2 weeks? Seeing the the public service orientation of our staff, that we're so ready and willing to do that. Anyway, that's something that I'll be thinking about in the coming months of how this regionalization could be non-geographic and we could help as well.
Well, on that note, you kind of brought us full circle back to Helene, and that is a perfect place to conclude the panel. I think we're right on time. So I just want to end by thanking everyone, thanking the panel. Thanking you for your time and your expertise. And also thanking Deloitte and EPA and DWI for their partnership in putting on this track. Thank you all.
Oh, it wasn't all the time.